Assalamu alaikum. Health assessment BSN Unit 7 assessment of breast, axilla and genitalia fast reading कर रहे हैं. तो objective by the end of the unit learner will be able to discuss the history questions pertaining the male and female breast and genital assessment, perform breast examination including auxiliary nodes and interpret finding, discuss component of genital exam on a male and female, document finding, list the changes in the breast, male and female genitalia that are characteristics of the aging process. Anatomy and physiology of breast: subclavian vein, subclavian lymph node, pectoralis major, axillary vein, axillary lymph node, axillary tail of breast. This is the face, gland lobes, and serratus anterior, upper outer, upper inner, lower outer, lower inner. This is the in four quadrants divide, and this node is called areola. Breast quadrants, four quadrants: upper and lower, upper inner, outer inner, and outer. Tail of spines. Clinical breast examination CBE, clinical breast examination by the healthcare professional every 3 years for women between 20 to 39 years of age and annually after 40 years of age. इसका मतलब ये है कि 20 से 39 साल की उम्र वाली 3 ईयर फॉर द वुमेन और 40 एक बार करेगी और 40 से ज़्यादा जो एनुअली वो ब्रेस्ट एग्जामिनेशन करेगी. Early mammography for women 40 years of age and older. मैं फास्ट रीडिंग करूँ क्योंकि आप समझते हैं, सिर्फ इसको लेसन करना है फोकसली. फॉर वुमेन इट इंक्रीज रिस्क. मैनी clinicians advise initiating screening mammography between age 30 and 40, then every 2 and 3 years until 50 years of age. Assessing subjective data: history of breast disease and surgery, lumps and thickening, discharge, rashes, swelling and trauma, pain. Does patient perform self breast exam? Monthly axillary tenderness, lumps or swelling. Assessing objective data: inspections, patient sitting, disobey to west, node symmetry, size and shape को देखना है, skin normally smooth and even in color, observe the axillary supraclavicular areas for any bulging, discolorations or edema को देखना है, nipple symmetrical है, flat है, inverted है, discharge है या bleeding है. Screen for retractions. Ask patient to lift arms slowly above head. Both breasts should move up symmetrically. Push hands into hip, arms etc. Lean forward. ये आपको ब्रेस्ट एग्जामिनेशन का ट्रिक्स बता रहा है कि कैसे हाथ को ऊपर करो, आर्म्स ओवर द हेड, आर्म्स एट साइड और हैंड्स प्रेस्ड अगेंस्ट हिप्स and leaning forward. Inspect and palpate axilla. While patient is sitting, lift and support the arm so patient muscles are relaxed. Use right hand to palpate left axilla. Reach finger high into axilla. Move fingers firmly down in your direction, down the chest wall, along the interior and posterior borders of axilla and around the inner aspects of the arm. Move arm through the rhomb to have access to areas. This is a lateral, central, deep vein, axilla, supraclaviculars, infraclaviculars. Supraclavicular and infraclavicular will be lateral, central, and the subscapular posterior and pectoral anterior. The arrows indicate direction of the lymph flow. Breast palpation: supine position with small pedia pillow under the side to the palpated, arms raised over the head. Use beds of fingers and make gentle rotatory movement on breast. Use a pattern of concentric circles or literally like spokes of wheels. Palpate all areas of breast clockwise fashions. Make sure to tail. Finding: consistency, tenderness, physiologic nodularity, infections, premenstrual tenderness, nodules if present, note location, size, shape, consistency, delimitations, tenderness and mobility, cyst, fibroadenoma, cancer. Consistency, physiological nodularity, and skin dimpling, ये देख रहे हो स्किन डिम्पलिंग, abnormal counter. Look for any variations in the normal convexity of each breast and compare one sides with the other. Nipple retractions and deviations. A retracted nipple is a flattened or pulled inverted. It may also be broadened and feel thickened. The nipples may deviate or point in a different directions, typical toward the underlying cancer. Edema of the skin. This is the edema of the skin, from lymphatic blockade appearing as a thickened skin with enlarged pores, so called the sud orange peel signs. This is, and the Piggott disease of the nipple, an uncommon form of the breast cancer that usually start as a scaly eczema like lesions. The skins may also weep crusts and crude. The breast's mass may be presenters suspect Piggott disease in any persisting dermatitis of the nipple and areola, dermatitis of the areola, and erosions of nipple as shown in diagram. Uh, by manual breast palpation for for the pendulous breasts, patient sitting, leaning forward, support inferior part of breast with one hand, use other hand to palpate breast tissue against supporting hand. Examination of nipple performed after breast palpation. Palpate nipple, noting any indurations or mass. Use thumb and forefinger to apply gentle pressure to note any discharge. Characteristic of breast lumps. Location, use breast clock face to describe distance from nipple. In centimeter, use diagram to locate size in centimeter. Shape, oval, round, lobulated, and indistinct. Consistency, soft, firm and hard. Movable, freely movable, fixed है to chest wall. उसका टेंडरनेस कैसा है? निपल, डिस्प्लेस्ड, रिट्रैक्टेड और डिम्पल्ड. Teaching self-breast exam. Assist patient to establish a schedule, regular monthly exam. Majority of women never get breast cancer. Majority of lumps are benign. Early detection is important. In non-invasive cancer, cervical is closed to 100%. सेल्फ ब्रेस्ट एग्जाम किस तरह करेंगे? टीचिंग पोजीशन, स्टैंडिंग इन फ्रंट ऑफ मिरर, इन द शावर, सोप एंड वाटर असिस्ट पाल्पेशन या सोपाइन. कीप टीचिंग सिंपल, demonstrate to patient and use return demonstrations. दिस इज़ द सोपाइन पोजीशन है और आप इस तरह पेशेंट इस तरह चेक करेगा. पेशेंट इंस्ट्रक्शंस फॉर द ब्रेस्ट सेल्फ एग्जामिनेशन. पेशेंट्स तबो या फीमेल्स तबो तो द इंस्ट्रक्शन का एजुकेट करे बच्चे हाउ टू चेक सेल्फ एग्जामिनेशन ऑफ ब्रेस्ट. लाई डाउन विद द पिलो अंडर योर राइट शोल्डर. प्लेस योर राइट आर्म behind your head. Use number 2. Use the finger pads of the 3 middle fingers on your left hand to feel lumps in the right breast. The finger pads are the top third of each finger. Press firmly enough to know how your breast feel. Firm ridges in lower curve of each breast is normal. If you are not sure how hard to press, talk with your health care provider. Try to copy the way the doctor or nurse does it. Press firmly on the breast in up and down. Strip patterns, also use a circular or wedges pattern, but be sure to use the same pattern every time. Check the entire breast area and remember how your breast feels from month to month. Repeat the examination on your left breast using finger pads of the right hand. If you find any changes, see your doctor right now. बस इसी तरह चेक करेंगे. अगर कोई लेजन या मास वगैरह बन रहा है तो डॉक्टर के साथ कंसल्ट करें. ब्रेस्ट एग्जामिनेशन टेक्निक ये है, इस तरह पालपेट, इस तरह सर्कुलर, फिर बल्जेस, फिर लाइंस के साथ. स्टैंडिंग है और इसी तरह मिरर पे देखेंगे. स्टैंडिंग, रिपीट द एग्जामिनेशन ऑफ बोथ ब्रेस्ट वाइल स्टैंडिंग विद वन आर्म बिहाइंड योर हेड. The upright position makes it easier to check the upper outer part of the breast toward your armpit. This is where about half of the breast cancers are found. You may want to do the upright part of the while you are in the shower. Your soapy hand will make it easy to check how your breast feel as they glide over the wet skin. For added safety, you might want to check your breast by standing in front of mirror right after your breast self-examination each month. See if there are any changes in way your breast looks, such as dimpling of the skin, changes in the nipple, redness or swelling. If you find any changes, see your doctor right away. The male breast. Male के breast small. Examination can be abbreviated but not omitted. Inspect the chest wall, noting skin surface and any lumps or swelling. Palpate nipple areas for lumps or enlargements. Normal male breast has a flat disc of undeveloped breast tissue beneath the nipple, should be even with no nodules. इदा गाइनोकोमेस्टिया, ये हार्मोनल चेंजेस की वजह से गाइनोकोमेस्टिया हो सकता है या ड्रग्स की वजह से. Documentation of female breast as Danny's breast pain, lump, discharge, rash, swelling, trauma. Danny's past history of breast disease या surgery status. Perform monthly breast exam or inspection. Breast symmetric, skin smooth with even color, no dimpling or retractions elicited, no nipple discharge, no lesion. Palpation, breast counter and consistency firm and homogeneous, no masses or healthy breast bilaterally with no sign and symptoms of abnormality. Reinforce breast self-examination. Patient perform breast monthly follow up with the MD for referral for money for mammography. Male genital system is a vessel difference, blood vessels, urethra, corpus cavernosum, corpus spongiosum, cornea, glans, will be prepuce, urethral meatus, cavity of tunica vagina, will be scrotum, testis, epididymis, will be spermatocord, ejaculatory duct, and seminal vesicle. This is the anatomy of male genital system. हेल्थ हिस्ट्री उसका क्या है, व्हाट इज़ योर रिलेशनशिप स्टेटस, इसको नेक्स्ट वीडियो में डिस्कस करेंगे. ओके, अल्लाह.